The discovery of a new highly infectious COVID-19 variant has got people worried. The variant, nicknamed Kraken, was detected in the country last week. Health professionals have advised the public not to panic but remain vigilant. Let's rope in Professor Salim Abdool Karim from the Centre for AIDS Programme of Research in South Africa for more on this. And he joins us via Zoom this afternoon. Prof, as always, thank you very much for some of your time this afternoon. Let's maybe start by giving a broad explanation of this highly infectious new variant that has now been detected. Give us a little bit of detail around it.
A very good afternoon to you and to all of the viewers. So let's just be very clear to start with that this is not a new variant of concern. This is a mutation of Omicron. So it's an Omicron variant that has some additional mutations. And that's quite important to make that distinction because, I mean, there are people who are just scaremongering by referring to it in terms like Kraken and so on. That's all just nonsense. In simple terms, this is a new version of Omicron. It is a version that has ability to escape antibodies, but that is with most of the new variants that they have that ability. Fortunately, when you look at this variant, it has descended from a variant that we have already experienced in South Africa called BA.5. And because BA.5 has already caused a wave of infections in South Africa in the middle of last year, we have widespread immunity to BA.5 and indeed from vaccines and past infection to the virus more generally. And so we do not expect that this new version of Omicron is going to cause any more severe disease than just a spike in infections at most, and then we would expect it not to pose any serious threat. So let's just be quite candid that this is not a new variant of concern, that it's just a variation on Omicron.
And of course, people are still being warned to be vigilant and take care of themselves as best as they can, Prof. And in doing that, what are the recommendations around vaccinations and getting boosters when it comes to this new version of Omicron, as you've just described?
I think the critical issue is that those who have immunity are in a good position and don't need to be concerned. But the people who do need to take extra precautions are the elderly. The elderly, whether it's a new variant or the old variants, the elderly always run a slightly higher risk for two reasons. One is that immunity is not built to the same high levels in elderly people from vaccination and natural infection as it occurs in young people. So elderly people, their immunity is not as at the same high levels in their antibodies. The second is that the elderly are at higher risk of severe forms of the disease. So my advice to everybody is to ensure that you have taken 3 doses of the vaccine. If you've taken 3 doses of the vaccine, then that gives you quite significant protection. But if you've taken your last dose more than, say, 6 to 9 months ago, my advice would be, if you're elderly, if you're over 60, take another dose. So take a 4th dose for those individuals who haven't had a dose in the last 6 to 9 months. So that would be a very simple way of looking at how we may use vaccines to protect us from this virus that's spreading. Should be pointed out that this particular variant, XBB.1.5, or put very simply referred to as XBB.1.5, is actually spreading in many parts of the world and has been spreading for months. It is the cause of the wave of infections we are seeing in the US, and that wave is also proving not to lead to many hospitalizations. But it is spreading in much of the world. So it was just a matter of time before it was also present in South Africa. It's not any surprise.
Yeah, and you've just mentioned the severity of illness to elderly people, or the risk thereof of the sub-variant. For the general population, you did mention that we might see a spike in infections because of its high transmissible nature, but the severity of illness, are we expecting anything like we saw in the first 3 waves, for example, Prof, or is everything going to be relatively calmer, in inverted commas, than we saw previously?
Because XBB.1.5 has been spreading in other parts of the world, we have quite a lot of information about it. And there's now pretty good data also on the ability of antibodies and T-cell immunity to neutralize this virus. And so what we have now seen from the clinical picture in other countries is that while XBB.1.5 may lead to additional infections, doesn't really lead to any significant increases in hospitalization. So that the increase in hospitalizations, if they do occur, are quite marginal and small. So we are not expecting in South Africa, given our widespread immunity, that we're not expecting to see any significant increase. There may at most be a small increase in hospitalizations. But what we may see are new infections of people with a bit of a cold, cough, a bit of fever, loss of taste that occurs with this quite often. So we'll see a few of those symptoms and people getting ill as a result of that, but we're not expecting severe disease and deaths like we used to. Indeed, for most of the world outside of China, the pandemic emergency is receding. For us, we're no longer panicking or no longer having to take drastic measures when a new version of the virus is emerging. But that can change. We know that with this virus, a new mutation could create a whole new variant, and that's what we always have to be vigilant about. That risk is getting smaller, but we have to remain vigilant about it.
Prof, would there be any need for government intervention at this stage? And I'm not talking specifically about restrictions, but perhaps around the quarantining or isolation period should you test positive, or are we expected largely to stick to the latest rules that were defined by the relevant departments when we saw the tapering down of the severity of COVID-19?
I think that there's no need for any new measures to be taken, in my view. And I would say that there are really 3 things that we should just continue to do. And it's got nothing to do with the fact that we now have XBB.1.5. It's just good medical care and practice so that you minimize your risk of infection. And those 3 things are: 1, ensure you are fully vaccinated, and 3 doses of the vaccine pretty much give you as good immunity as you're going to get. So make sure you've had at least 3 doses of the vaccine. So that's 1. 2, do as much as you can outdoors. Try and avoid indoor settings as much as possible. And so, because the virus risk is so much lower in the outdoor settings. And the 3rd is, if you have to go indoors, like me, I have to sometimes go give lectures. If you have to go indoors, maintain social distancing and put on a mask. And to the extent you can use masks, that would be my recommendation if you are going into a closed, poorly ventilated indoor setting. So it's 3 things: vaccination, try and do things outdoors, and if you have to go indoors, use a mask.
Prof, we do have a little bit of extra time remaining, and I just wanted to broaden our conversation beyond the sub-variant. And there's been a lot, and I'm sure you would have seen in the news cycle, discussions around long COVID and managing that, and various instances of people that have suffered from COVID-19 struggling to shake off the long-term effects. Maybe tell us a little bit more about this long COVID and what you're seeing in terms of what might be working to perhaps remedy the body from the severe effects of what would have been an infection previously?
I'm very deeply concerned about the future of what the next 3 to 5 years is going to look like as we see increasing cases of long COVID manifesting. So let's just understand that we originally thought of COVID-19 as an acute respiratory, in other words, an acute short-lived lung infection. We now know that that's not true, that indeed it infects the entire body, literally from head to toe. So it affects the entire body. Multiple organs are infected. The lungs are where you see most of the clinical manifestations, but it infects most of the body. And secondly, it's not only acute. There is a chronic component to this disease, and that's in the long COVID. And it's thought that about 10 to 20% of people may develop long COVID, and long COVID presents in various ways, but mostly it presents as people who feel a bit muzzy, their memory is not so good, they can't think clearly, they talk about, it's like a cloud over me, but it also manifests in heart disease, it manifests in increase in diabetes, it manifests in mental health. So there are many of these, and we expect to see cases of these increase over the next few years from the individuals who had natural infection from COVID-19.
And are you concerned, Doc, as a final thought from you, that a lot of these cases that you anticipate you'll be seeing will come from younger people? And I mean specifically here about the more concerning ones around heart disease and other ailments that could have come from previously having contracted COVID-19.
I think you're making a very important point that I was amiss in not making earlier. And that is, long COVID is not associated with only people who had severe acute infection. You could have had a very mild form or even an asymptomatic form of acute COVID when you had the original infection. Even if it was very mild, you are still running the risk of long COVID. And so we are expecting that long COVID is going to impact across the entire spectrum of the different ages. And then we're going to see people who are young now presenting with heart disease. And we're already seeing that. I mean, Discovery just reported at the end of last year a 50% increase in patients presenting with heart disease, and largely associated with initial COVID-19 infection. So we're already beginning to see those effects. They're just going to systematically get worse over the next few years. So we talk about, while we've had the initial waves of infection of SARS-CoV-2, now we're seeing, the tsunami that's coming of long COVID, and we're going to have to deal with that in our healthcare services.
Professor, thank you very much for your insights this afternoon, as always, talking there about the subvariant of Omicron, and that while there's no need to panic, it is important to remain vigilant and make sure that you are vaccinated and take care of yourself as best as you can.